All right, this is week one, part five, fundamentals of phlebotomy. We're going to talk a little bit about infection control. All right. All right, infection control is so important for you as a healthcare professional because it is part of your job to make sure that you are protecting yourself, others, patients, coworkers. Um, control and being negligent can, lead to injury to yourself and others. Um, it has a lot more to do with safety than we realize. So let's talk about infection control. What is an infection? You need to know an infection is a condition that results when a microorganism or microbe is able to invade the body, multiply, and cause injury and disease. You need to know these examples of microbes: bacteria, fungi, protozoa, and viruses. You may see a question that says ova in there. Ova means egg. Eggs are not a virus, okay? Just FYI. All right. A pathogen is a microbe capable of causing disease. This is very important to know this definition. A pathogen is a microbe capable of causing disease. An infection is a condition that results from the microbe invading the body. Okay? So here we have examples of viruses, okay, and bacteria. So we have right here on top, this is bacteria. This is a gram-positive bacteria. This is a bacteria. It's gram-negative. We've got some viruses and bacteria going on right here. So a bacteria with that structure is going to be similar to the family that staph comes into play. This is what it would look like under the microscope, okay? And then this one here, this belongs to the family of like Salmonella. We call it gram-negative. Okay, you don't have to know these terms. I'm just showing you because I think they're really awesome, cool pictures, and I'm a little bit of a nerd when it comes to that. Okay, and I thought you might enjoy seeing the visual and how cool our freaking bodies are, right? So over here, where it says the viral shapes, like, wow, this looks like something out of a sci-fi movie, but this is actually what viruses actually look like. They come in all different shapes. They look little nano robots and stuff. But this is also why they're so hard to kill, right? Here are some organisms that also cause infection. It would be considered protozoa. All right. This one is actually an STD that you can find in urine. This is an example of yeast, like a yeast infection. This is also an example of yeast, and this is a little parasite there. All right. Pretty cool stuff when you look at it under the microscope.
I do want to add that the yeast is a fungi, not a protozoa. All right, let's talk about the different types of infection. We have a communicable infection. That means it is able to be spread from person to person. And the agency that investigates and controls communicable diseases and epidemics is the CDC, or Center for Disease Control. Now, both of those bullet points here are important, okay? So you should remember these two things. And the CDC is the Center for Disease Control. All right, let's talk about nosocomial and healthcare associated infections. All right, so the first term, nosocomial, this is a term that we used to use to describe an infection you got from the hospital. So that means you went in for a UTI and came out with C. diff, or you went in for surgery and came back and got an infection like UTI while you were in the hospital for the infection. Now, this term we don't use as mainstream anymore but you still need to know it, okay? Now, the healthcare associated infection. What they did is they broadened, for the sake of health of our patients, they broadened this term and they put it under the umbrella of patient safety and something that we monitor throughout all of healthcare. So, healthcare associated infection, or it's abbreviated HAI, is an infection acquired in a hospital and other healthcare settings like nursing home, doctor's office, urgent care, anywhere that you're receiving healthcare, okay? And you go in with a condition or for something else and you leave with an infection or you get an infection as a result of going there, then that is a healthcare associated infection. Okay, this is important to understand what this means, because you will have on your certification and you will see on tests where they're going to give you an example scenario of a patient or visitor client. They're going to give you a scenario and they're going to ask you if it's a healthcare associated infection or not. Okay. Now, 1.7 million healthcare associated infections and 99,000 associated deaths occur each year. Those are preventable for them. I would say the majority of those are preventable, okay? These infections, you need to know, are caused by infected personnel, patients, visitors, food, drug, and equipment. All right? Infected personnel, that is us as healthcare workers not following standard precautions where we treat everyone as if they have an infection, okay? That's healthcare workers not following the signs on the outside of a door when someone has contact precautions or droplet precautions. There's something going on and we need to put gloves or gowns and those things on. It's not washing your hands before and after you put on gloves. It's not washing your hands every time you enter and exit a client's house or room, wherever you're at, okay? Patients, that's patients not following guidelines that we set for them, not washing their hands, not putting things away. Patients can, be helpful in that process if when they have visitors, they tell the visitors like, hey, you have to put on gown, you can't walk in and out, don't bring food, don't bring things out of the room. Visitors have a responsibility. Food can pick up stuff all along the way. Drugs can be dropped on the floor. Bottles cannot be cleaned before they're punctured to administer a vaccine or medicine. And then equipment, when you're moving from patient to patient, make sure that you're cleaning your equipment. You are not reusing your equipment that is not supposed to be reused. You're cleaning things before and after. So it's a big responsibility that we have to take care of our patients, okay? All right, we're going to talk about something here. I just talked about C. diff, and I talked about when or washing our hands before and after we leave a patient's room. Now, we all know that we can use hand gel, right, to sanitize our hands. In phlebotomy, this is important to know. You are expected to, in healthcare, really, you are expected to sanitize your hands either by hand gel or hand washing before you put on gloves and after you put on gloves. And you need to understand that our gloves are meant to protect us from the patient, not the patient from us, okay? Now, this is something you need to know. About every 5 hand gels, you should be washing your hands. If your hands start to feel, ugh, yeah, you need to wash your hands, okay? Hand gel is just a substitute. And they make them now so they kind of don't dry out your hands. And I understand the use. I use it myself. But we should realize that nothing is a substitute for washing your hands. And this next point proves it, okay? You're going to have signs if you're working in a facility and they are caring for someone with C. diff that says, stop. You cannot use hand gel. Do not use hand gel. You must use soap and water before leaving the room. And that is because C. diff is an infection. C. diff, actually, Clostridium difficile is the name.
What causes this C. diff infection. Okay, and this is a putrid. If you've ever smelled it, you will never forget the smell. It's a very putrid diarrhea that can cause death because you can't control it, and it's especially harmful for young children and people who are immunocompromised, who already have issues going on, or the elderly. Okay, and it is really hard to get rid of, and it is caused by um, when someone has gotten sick and they have taken an antibiotic and it's killed off all their good gut bacteria. There's other conditions that can do that as well, but what we're focused on is um, the infection that is acquired typically because they're in a healthcare facility, because they're getting a really strong antibiotic, typically by IV, is when you see it the most. That's not to say healthcare workers, family members, things like people like that can also get it because it's highly contagious. All right. Um, so what happens is the organism that causes this, or the bacteria that causes this condition, is very hardy. By that, I mean it's hard to kill. So it is a spore. So alcohol gel is not going to get rid of the spore. It's just going to roll around in it and stay on your hands, and it's not going to kill it. Okay? That spore, it's a survival. So what it does, it hardens and nothing can penetrate it, right? So um, the only thing that gets rid of C. diff is really just washing it down the sink with soap and water. Okay. So that's why they say you cannot use hand gel. You're going to spread C. diff. And if you are a healthcare worker in general, not only a phlebotomist, but for phlebotomists specifically, too, we try, we can have a job where we travel to different parts of the hospital, right? A phlebotomist is often traveling to various places in the hospital, getting stat labs, doing things, okay? And you would not want to take C. diff from one of the floors into the ICU or the NICU or someone at the cancer floor, like places where people cannot fight it like others can. They're already fighting a lot of other things. So we need to be really mindful of this. This is a really serious one. It can cause a lot of problems, okay? You'll see it prevalent too in nursing homes. You promise you won't forget the smell. All right, we are going to look at this next slide here. And this is what it looks like under the microscope. Okay, this is the really cool microscope here on the left, and then here on your right, this is what it looks like inside the intestines, and all of this like sloughs off. Okay, so that there is a treatment for it. You will get Flagyl, but the thing about that is sometimes it doesn't work. Okay, because you're still killing. I mean, it's basically you're still killing off stuff, trying to get that good bacteria a chance to grow back. And some people have to have what's called a stool transfer. Okay. And if you're working in a lab in a hospital, you may have to handle not the collection of it, but when it is brought back to the lab. Okay. So, and we'll talk more about that in our special collections series. So, with the stool transfer, they find a match. They find someone, often a family member, and they give a stool sample, and they will make a capsule out of it. And the person would take that capsule, take that, and they do testing to make sure that the person that they're getting the donation from is not sick, doesn't have anything going on, and that it is healthy bacteria that's going to be transferred. Okay. And then the stomach digests it, and it releases basically that bacteria into the gut, and it helps fight off and get the C. diff under control. Because C. diff naturally is in our gut, but in very small amounts. All right. Now we're going to talk about the chain of infection. You need to know this inside and out. This is something that, as a healthcare worker, you are going to see this. You're going to get training on this. Like, you'll see this a lot, okay? So, the first component of the chain of infection is our infectious agent, or the thing that is causing the infection, okay? We have pathogenic microbes, or pathogenic, capable of causing disease, microbe, short for microorganism, that is responsible for causing the infection. You need to know that. The infectious agent is the pathogenic microbe responsible for causing the infection. Next, we need to have a place where that infectious agent can survive, grow, and multiply. We call that the reservoir, okay? You need to know this. The reservoir is the place where the microbe or infectious agent can survive, grow, and multiply. You need to know examples of reservoirs, okay? We have animals, food, soil, equipment, water, okay? Okay, it looks like our last point here got cut off, so I'm going to write it in for us. The next thing we have from the reservoir, we have the exit pathway, right? So this is how that infectious agent or microbe will leave the reservoir, okay? That's important to know. And then all right, so blood. All right, exudates, that would be, when you have like a really nasty wound that maybe you like really nosedive on the sidewalk and got a really big, nasty spot and like, got all pussy and gross and weepy. I know this is a terrible description, guys. I'm sorry. But that nasty oozy stuff, that's exudate, okay? Excretions would be like tissue fluid coming out of the area. Secretions would be like the tissue fluid. Excretions, I'd be like if a cut, I believe. Yeah. So, however it is leaving that reservoir, that is an exit pathway. Okay. Oh. And then we have our means of transmission. So it's left the reservoir, it's at the exit pathway. Now it has to get to where it wants to go. Okay. So that is the means of transmission. Means of transmission can be by airborne, by contact, by droplet, by vector, and by vehicle. Okay, so you do need to know different examples of each of these means of transmission. Okay, so airborne would be like, airborne is not the same as like coughing in the air. So the best way I can describe airborne, because it's very similar to the droplet, okay? But airborne illnesses like chickenpox, okay? Um, these things can be transmitted just by breathing, okay? You can laugh or you can talk or, droplets may come out, but like just breathing can do the cause airborne transmission. Okay, then we have contact transmission. So that's direct touch. Okay, that's touching, kissing. Direct contact transmission is touching or kissing. Indirect contact transmission is coming into contact with a contaminated object. So if I touched the table and got a drop of bacteria on my finger, a drop of blood on my finger with bacteria in it, and then I touched my eyeball, that is indirect, even though you're touching, right? Or say I got a needle stick and then I touched my eyeball, like that's indirect, like the contact happened elsewhere. That's like a secondary contact, if that makes sense. Okay. And direct is like, that's the initial. So like the needle stick would have been the direct contact, and or me touching the table would have been the direct contact. Okay. That's how you can look at that one. Droplet would be those droplets after you've coughed and sneezed that hang out in the air and then someone walks through it. Okay. Vector is an insect, arthropod, or animal. Okay. And then vehicle would be food, water, and medicine equipment. Okay? You do need to know that the most common type of healthcare associated infection is the UTI. Okay? That is important to know. Here. All right. So now it's been transmitted. It has come in contact with our new person, okay? Our new host, our new reservoir, our new host, okay? And it needs an entry pathway. So the way this microbe enters a susceptible host would be body orifices, mucous membranes, or breaks in the skin. Okay? Our mucous membranes would be like up our nose. Well, that could be a body orifice. Like our eyes, right? Our mouth, like our cheeks and stuff. And then, so we come in contact with microbes, bacteria, viruses all day, every day, right? But we typically all have healthy immune systems and they don't affect us. They are blocked by our immune system and we don't even realize it. But if you are a susceptible host, which is someone with a decreased ability to resist infection, you will get infected, right? You'll get a disease. You'll have an infectious disease. All right. So factors that make people a susceptible host: lowered immune system, being immunocompromised, having autoimmune diseases, their overall health, their age, very young, very old, So, and all of these steps have to occur for an infection. Right here, we have examples of exit pathways are blood exudates, excretions, and secretion to happen, right? Like each one of these links have to be there for there to be an infection. And the way that we prevent infections is breaking the chain. Our goal is to break a link in the chain. And that's important. The most effective and common way to break the chain of infection is hand washing, okay? Hand hygiene, but especially hand washing with good old soap and water, okay? Now let's talk a little bit about how we would stop the infectious agent, okay? We know that there's a place that's contaminated. We go ahead and clean it up with bleach, right? Or whatever germicide we have, whatever our lab or facility protocol states. A reservoir: animal, human, equipment, food, soil, and water. We would not allow standing water around our homes so that we don't breed mosquitoes, okay? We would make sure that we get our dogs and animals, our cats, flea and tick prevention. We're taking care of our body, good hygiene, good self-care, taking care of our immune system. Okay. We're making sure that we're covering our cuts and being mindful of what's going on in our body. All right. Our exit pathway with blood, exudates, excretions, secretions. If you know you have an infectious disease and you could have an exit pathway, you're going to take care of that. You're going to be mindful of that. You're not going to walk around with your exudates dripping everywhere, right? You're going to take care of it. I know that's gross, but the means of transmission, airborne, contact, droplet, vector, and vehicle, you're going to make sure that you're cleaning the medicine dot bottles before you stick a needle in there. You're going to make sure your phlebotomy equipment is sterilized and you're not reusing things. You're not using things that have dropped on the floor to a patient. We are being mindful of standard precautions and accepted procedure that works. Not as long as we're not taking shortcuts and we are following the directions, we prevent infections. It's not an issue, okay? But that's where it obviously is an issue. There's enough people who are not doing that. So if we all just do our part that we're supposed to do, then we will be fine. We won't have such a problem, okay? We can limit it to the things that are not preventable. All right, our entry pathway, body orifices, mucous membranes, broken skin. If we are working in the lab, we're going to cover our skin. If we're working in healthcare, if we have a break in the skin, we're going to cover it. We're going to wear gloves. We're going to use gloves when we handle food. We're going to make sure we are covered. We have face shield, face masks. We're going to take care of any possible entry pathway. We're going to be mindful of where we are and how many germs are actually around us. A susceptible host, we're going to make sure that the immune compromised, the unvaccinated, these people, we take care of them. We are mindful and we do our extra mile and our extra part to shield them because they are susceptible hosts and sometimes, their susceptibility is not their fault or their decision, okay? But once we break one of these parts of the chain of infection, the infection does not occur, and that is our goal. All right, I'm going to leave this here for you all to stop and kind of think about each one of these and kind of get an idea in your mind of what goes on with the chain of infection. All right, we talked about some of these already. You can pause here. I do want to talk about disposal of sharps and infectious waste. We will always observe our standard precautions. We're going to use PPE. You do need to know that PPE stands for personal protective equipment. Okay. You must be fully aware of the infection process and do your job to prevent that. Okay. All right. I thought this slide was really cool. I read the story behind this slide. This kind of goes back to our hand hygiene. This is a look. So I used to work in microbiology, so this is why this is so fascinating to me. So this is a microbiologist, and she was doing a project, and what she did was have her 5-year-old put their hand on this plate. This plate has a media on it, so underneath it is just a clear layer of looks like gel or jelly, and it has nutrients for the bacteria to grow. So different bacteria will grow because they are being fed, right? So all of this is a 5-year-old's hand before they went to go wash up for dinner. And the cool thing was the lady was saying that nothing on here was pathogenic or nothing on here was deadly or so dangerous that a healthy immune system could not take care of it. It's all natural, basically. Things that we would come in contact with. It's not like salmonella or C. diff or anything like that. So I thought that was really cool. And then the other part of it was after, having the child put their hands on after to show them how well they wash their hands or not. So yeah, I thought that was really cool. Our world is awesome. All right. So this um, is an example of, I just wanted to show you, like, this was a nurse, right? They were trying out a new hand sanitizing product. So this was the bacteria before she washed her hands. And then this was after using the hand gel. So again, like, we just really want to promote hand washing as much as possible. I know, like, you'll see us in the lab when we first go into the lab, we'll always wash our hands, but then we'll probably use hand gel the rest of the day because it's your hands are wet. It's really hard to get those gloves on. So it is understandable, but we need to remember about every 5 hand gels, we need to be washing our hands, okay? And it is important as phlebotomists, every single time you put on the gloves, you put on hand gel. Every single time you take off the gloves, you put on hand gel or hand wash, okay? All right. If you have any questions, remember, just shoot them into our discussion section and I will answer any questions that you may have. I will see you all soon.